Now
There
did
it
that
is.
change just to test it?
Yep.
You see the
Okay.
third? Okay. All right.
Yep.
Thank you. Sorry
Great.
about that.
No, no problem. These are the joys of virtual meetings. So, um, so as I mentioned, I'm an emergency medicine physician, and we founded this organization, myself and three other emergency medicine doctors. We call ourselves telehealth pioneers. That's not too difficult. It's not been around for that long, but for about 5 to 6 years now, we have been using telemedicine to deliver medical care to individuals with IDD. We can, of course, treat all complex medical issues, have had over 15,000 encounters to date, and unfortunately, a lot of experience with COVID-19, being up in New York. All of our physicians, besides being board certified, also are specialized to care for individuals with IDD. And you guys probably know it's not every physician is comfortable with this population, and we're currently practicing in multiple states. These are just some of the organizations that we are members of or are spoken about. I've actually spoken at the National ARC Conference and many other state ARC chapters. And I believe our CEO, Dr. Kaufman, has met with you guys and speaks very highly of Mississippi. So we're excited to be presenting today. It's just a busy slide here, which just says, individuals with IDD tend to use the ER more often. They tend to use it, one, because they have, complex medical issues, but also I think a lot of times our individuals don't have a physician to turn to, or if it's late in the evening or doctors aren't comfortable, so they end up landing in the ER or urgent care for things that you or I maybe wouldn't need to go for. The most important point here is that you can see in red, individuals with COVID-19, the preliminary studies show that they're about 5 times more likely to contract COVID-19, and then a higher mortality, meaning deaths from COVID-19. A lot of that's due to the comorbidities and respiratory issues they may have, but also individuals are in group home settings. They can't maybe socially distance. It's very concerning. As I mentioned, I'm in New York, and we have worked with several group homes where individuals have contracted the COVID-19, and we've had several deaths, and then a lot of DSP support staff also have gotten sick. Of course, the other issues for hospitalizations are ones you're familiar with: seizures, pneumonia, GI issues. But they tend to get hospitalized more frequently. Even if they land in the ER, they tend to get admitted. I'm not going to go into too much detail. We are all familiar with what's going on with COVID-19, but I guess the emphasis would be, really, it's a challenge for individuals with IDD, largely because of the things I mentioned, the way their residential settings and socially distancing is difficult. Sometimes these individuals rely on other people to do a lot of things for them, so they're definitely more exposed, but some of the underlying medical issues they have do lead them to be more susceptible to the virus. So, going to the ER is terrible for anyone, but I think it's especially frightening for individuals. And this was kind of how our organization, how we started the company. I mean, I saw individuals going there for med refills or simple issues such as cough, even to urgent care. And of course, it's extremely frightening for anyone to be in the ER, but for someone who may not be aware of what's going on, it's especially disturbing and disruptive to their routine. I used to do this presentation before COVID-19, and of course, now the exposure to infection is real, not just for the individual, but someone who has to take them there. Now more than ever, if you can stay at place and stay in your home setting, it's advisable. I have this missed medication here. I had an individual that years ago that came in because they couldn't find their doctor to give them a seizure prescription for their seizure medication, and that's all they came in for, and they ended up having a seizure, fell off the stretcher and hit their head, ended up having bleed in the brain. So, minor things for the ER, it's just very disruptive, and I think if you go to the next slide, it's really just suboptimal care. I am an emergency medicine physician, and my colleagues are all fantastic, but many of them aren't really trained to care for these individuals. It's not a big part of medical curriculum, and all of our physicians do get specialized training. So it's really, unspecialized care, of course, exposure and spread of COVID, and I won't even get into all the costs associated with it. It's extremely expensive to go there, especially if you don't need to. The other thing I'll add is individuals that end up in the ER tend to get tested unnecessarily. So you might go in there and find out that getting a CAT scan or blood work, and it's really not necessary. So what are the challenges for provider organizations? Of course, there's regulatory reasons and compliance reasons. These individuals have complex medical needs. So oftentimes the physicians may be reluctant to treat them over the phone. And then of course, staffing. When we started this organization, I didn't really appreciate the staffing issue and kind of a national crisis in terms of turnover and overtime and shortages. And an organization like ours, we really support DSPs, and to have the ability to speak to a doctor or just to answer questions within minutes has been really important for engagement and retention in some of the organizations we work with. Again, challenges the staff. I'm probably preaching to the choir, but there's job dissatisfaction, turnover, individuals that have to be sent out oftentimes decompensate, and injuries from decompensating behavior. So it is a challenge. So what are the benefits of telemedicine? I'm sure you guys have heard all about telemedicine becoming very popular now, especially during the crisis. But especially for individuals with IDD, it really helps them live independently in the community and of course, safely in a healthy life. The beauty of it is that there's no geographic impediments. We can be anywhere, and it really can expand access to specialized care safely. As you, again, probably aware of, why do people tend to use the ER in urgent care? Well, there's just a lack of access. Regulatory reasons. I don't know the specifics in Mississippi, but some areas that we're in, it's a regulatory regulation that they have to see a physician if there's any change in their condition, or at least see some clinical person. And the use of telemedicine can really help tick that box and make you meet your regulatory requirements. Oftentimes, primary care doctors aren't available. They may be busy in their office all day. So, our service is 24/7, and you can speak to a doctor within minutes. So on the left here are the problems, on the right are the solutions. As I said, the lack of access. There's no geographic impediments to telehealth. We can see anyone in any part of the state without any issues, as long as you have Wi-Fi or cellular connection. Suboptimal care, I mentioned that all of our physicians have specific training in IDD. We also, when we see an individual, have access to their medical record or EHR if you have one. If not, we create one. So I think that's very valuable. I don't know the specifics of Mississippi, but in many areas where I used to work, the individual would come in with a support staff who may or may not know them, and they would have a big binder that looked like a telephone book that I never read. I don't think anyone reads. And this ability to kind of look back at their history, their behavioral issues, their past medical, their allergies really helps provide a better level of care. Of course, again, we're available 24/7. So even when primary care offices are closed, you can reach a physician using telehealth. So on the left is telemedicine and the right is primary care. I want to emphasize that we're not there to replace primary care. We're really there to augment and help them and help coordinate care. So, if there's a high glucose reading, we'll address it. We won't necessarily have to manage their daily meds. If you need a med refill or clarification or reconciliation, we can do that. If there's any urgent medical issue that you need attention to, you can speak to a doctor. And then once we're there, we really complement the care of the clinic or the primary care doctor and really help provide better care as a team. And again, in a few slides, I'll just show you how the process works and how we bring the other physicians in the loop. This slide is just tells you about what we produced guidelines, for seizures, falls, rashes, of course, COVID-19. All of our physicians are trained, go through a certification process to care for this population, and then we provide quality reviews for everything. How many calls that came in, what diagnoses, and it does help agencies and organizations from a clinical perspective, but also from staffing. And then lastly, we have an educational series, which we provide as part of our whole solution, where we can do a webinar for anything that you want. The ones we've done in the past is seizure care or de-escalation or change in condition, when to call a doctor, whatever you feel is appropriate to help educate your staff. This is just a slide telling you about the data. We can provide you with whatever you want on a daily, weekly, monthly basis, and send it to you via email to your supervisor every day, so you know how many calls came in and whatnot. And lastly, I'm just going to go through the process. Very simple how to use, and this is a real example. So we've made the system as simple as possible. I always say we're not a technology company. We're a physician organization that just uses this technology to bring care for this population. But this was a real example. This was a 24-year-old with cerebral palsy and asthma, developed a cough and a fever of 101, SATs for about 90%. So that was the change in condition, and StationMD was activated. Activated meaning you just call one number. It's a 1877 number, and we get some basic information. So-and-so from Jackson, Mississippi is calling. We need to speak to a doctor. And then the physician does their assessment. The third block over on the bottom with the green, that's what the screen looks like. You press one icon, and if you know how to do this Zoom, or if you know how to do FaceTime or Skype, it's that simple. The facility will initiate the encounter, and the doctor reviews the patient's records, and we do our evaluation. I think if you go to the next slide, Anna. In this case, a physical exam was performed. On the bottom, you can kind of see what it looks like. It's basically just a tablet on a computer on wheels, and we have a Bluetooth stethoscope, we have a high-def camera, and we do our assessment. And in this case, the physical exam was performed, and the thought was it was an asthma exacerbation with a respiratory infection. Our doctors can e-prescribe, so we called in a prescription. They delivered it. And then about an hour or two later, the doctor called back to see how the individual was doing. They listened to breath sounds again, and it showed improvement. We have a portable pulse ox. The SATs were better. And then everything was documented in the electronic health record. And in this case, they securely sent that note and evaluation to the primary care physician, so they were aware of what happened. And a trip to the ER was avoided. I could tell you, as an emergency medicine physician who's been practicing for so many years, this individual probably would have had blood work, probably would have had a chest x-ray. Not unlikely that they could have been admitted, but I can tell you our evaluation here probably would take a half an hour to an hour. You probably wouldn't even have transportation ready for that individual. And I don't know how it is in Mississippi, but around here, you'd probably be sitting in the ER for 2 to 4 to 6 hours to wait to see a doctor. I want to emphasize that not all cases have to be emergent. They can be med refills, questions, constipation. I always say constipation today turns into a bowel obstruction tomorrow. A UTI can turn into urosepsis. So if you're not sure when to call us, just call us. We don't work on a per call charge. We are there 24/7 to support individuals in whatever medical needs or questions you may have. And lastly, these are just some of the outcomes. We'll make sure you get these slides too if you need them. But about 85% of the time, and this has been very consistent, we can keep an individual in place. Meaning, if you call us for a medical question or concern, 8 or 9 times out of 10, you don't need to go anywhere, and we can handle it using telemedicine and telehealth solution. And these are just some of the reasons we get called. The blue are the ones we keep in place. The gray are the ones that we transfer out. Constipation, cellulitis, fever, fall, fissures. I want to emphasize, for example, you'll see sepsis there. They all go out. Of course, we can't treat that using telehealth, But the one thing I will mention is that when we do send individuals out to the ER or urgent care or wherever, we will call the doctor in advance and say, hey, John Smith is coming from this group home for leg swelling. He just needs an ultrasound for a DVT. There's no need to do a bunch of blood work or keep him there forever. And it really just helps expedite the care and helps kind of focus the exam and the diagnostics, so you're not getting the A to Z workup and you're not sitting there for hours. So it does help. And it also allows the physician that's caring for the individual to turn them over to me and say, hey, look, I'm sending him back. Just follow up on him in the next hour or next day or whatnot. So it just really helps improve the time and also the quality of care that the individual is receiving. And then this is just a busy slide that shows how you can save money, and actually everything is paid for after paying for our services. I'm sorry. So on the left are what an agency of 200 consumers with an average ED visit. I think it's 2 visits per year per individual, and some places it's more or less. So you can plug in your own numbers, but these are the savings projected for an agency. And on the right, of course, the savings for a payer are much greater, because an ER visit's not cheap. Hospitalization's very expensive. So if you can avert those ER visits or urgent care visits and hospitalizations, it's a win-win. And of course, the payer, whether it's a state or an insurance carrier, can save a lot of money. And that's it. That's my phone number and email. Of course, you can go to our website, stationmd.com. I am happy to answer any questions now, but if something comes to you later and you want to send me an email, or if you'd like me to go over anything or do a presentation for your organization, I'd be happy to do that. I just want to, number one, thank you guys for what you do. I can tell you that in our area, I don't know exactly what it's like in Mississippi, but the virus has adversely affected us, and it's real up here, and we need to be advocates for this population. I've seen, unfortunately, it affect individuals and staff, and oftentimes they can't speak for themselves. So what you do is really important, and I just want to thank you. We need to really keep them safe, especially now. So I'm happy to answer any questions.
Dr. Trivedi, this is Matt Knocker from the YARC, and I appreciate your presentation. And I agree with 90% of all that you've said today. How does one that, like for StationMD, do y'all have a shingle that you hang here in Mississippi, or if I were a provider, how would I reach out to get my individual?
Yeah. So all of our physicians that would be caring for your population would be Mississippi licensed doctors, and we use telehealth. We don't have like a actual brick and mortar facility in Mississippi, but our doctors would be licensed Mississippi physicians caring for your your individual, and we would use the telehealth technology to evaluate them, but we don't have like a actual physical setting in Mississippi. No.
A couple of technical questions. I mean,
sure.
Do you find that, like an Apple product versus an Android product for an iPad? I just use the word iPad because it's kind of generic.
Yeah.
If Jamie here was an individual with a disability that I was trying to support, what would you think technology-wise, what's the minimum that I would need for you to be able to do your work and understand better what she needs?
Sure. Great question. So as I mentioned, we're not really a tech company, but the tech that we provide, we support 100%. It's 24/7 tech support. But I'll answer your question in a couple of different ways. If you wanted to see her right now, you can just download the app onto your phone or your iPad, and it's completely free, and you don't need anything. We could do the evaluation immediately. Now, we do have, like in this presentation, I showed you the notebook on a cart with a Bluetooth stethoscope and the high-def camera. We can get that for you. We don't make any money on it. Since we buy a lot of them, we get a big discount, and we can get you the pricing on those. I find those work a little better in like a group home setting that you can wheel around, and I can get you the quotes on how much that costs. But the short answer is you can there's no technology, special technology required. You can put it on an iPad, a Surface, a notebook, and again, you can also put it on your phone. Just download the app.
Do y'all find that using Wi-Fi is better or using cellular enabled ways to connect?
Yeah, so I find the Wi-Fi works really just fine. We are in some really rural areas where the Wi-Fi isn't that great, and that's where we just put in a and I'm not a tech guy, so we put in basically a hotspot, so to speak, that's on a cellular network, and it works just fine. But it's really just for, I would say 98% of the places we use Wi-Fi, and there's no issues whatsoever.
Thanks.
Sure.
The other question.
Dr. Trivedi,
Yeah.
there is a question from one of the participants.
Sure.
And does StationMD offer behavioral or mental health services from physicians or have experience with IDD patients? Since most of these patients are on Medicare, Medicaid, do patients pay you directly and wait for reimbursement, or do you file for payment?
Both excellent questions. So I'll do the first one. Yeah, all of our physicians are trained to care for behavioral issues. And you know, we've been doing this for a while, and you guys know that oftentimes the issue is a behavioral complaint. First and foremost, we got to make sure that that behavioral issue isn't something clinical or I should say medical. So all of our physicians are trained in that. And I can tell you that 80% of maybe 70% of the behavioral complaints we get, we can handle. We either de-escalate or figure out what the issue is and handle it via telemedicine. What we don't do is if an individual's harm to themselves or others, you know, those unfortunately still need to go to the ER for extensive behavioral assessments. And we also have a psychiatrist on staff that does IDD specifically, and so we can set up a scheduled behavioral assessment if you need that. But the short answer is we handle a lot of behavioral issues and specifically for this population, so we're trained. The second part is that we work just strictly on a subscription basis right now, meaning it's a flat fee and it's $30. It's per month, and you can call once, you can call 100 times. We don't bill insurance, we don't bill the patient. And that includes everything in all of our services. We are exploring billing the state or Medicaid or insurance carriers for this. It's kind of a moving target, and it's also evolving state by state. It's different. So if we can do that, then there would be no fee at all for the agency or the individual. But right now we have it at a $30 per person per month, just to make it, you know, inexpensive and easy to do, and covers the full services.
I did not see that on one of your slides. Would that be when you download the StationMD, all of that information would be on the app?
Yeah, you can contact me if you wanted to set that up. But yeah, we would, you know, if it's like, say it's in a specific agency or organization wants a contract with us, or however you want to do it, we just send you that. But that's the pricing. We can get you that. If it's not on the slide deck, what I can do is Ariana and I can send you a whole, it's just 1 or 2 pages that describes how the service works and the pricing. And I'll also make sure you get the equipment if you want the additional equipment and not the app-based thing.
Part of our goal with our partnership with Project START and the ARC and others that are true partners in this is to be a clearinghouse of information, not necessarily that I mean, of course, we appreciate and believe that what you're telling us is true.
Sure.
We want to have that all in maybe a consolidated in a resource,
Gotcha.
technology type resource for others to be able to know that that's even a choice. So
yeah. But yeah, what we can do is we can provide you with like a flyer, which kind of it basically describes what we do, the price, and the solution, and how it can benefit your organization, and make it easy for people to just look it up and reference, for sure. Yeah, I mean, the presentation is more for your kind of information in more detail, but we can definitely make it more simple. you know, so people can kind of look at it
Doctor,
quickly as a
we have a
reference.
question.
Yeah.
We have another question. Does StationMD have experience doing technology evaluations in schools?
Like physical evaluations? I'm sorry, what was the technology evaluations?
Victoria Anderson,
Uh-huh.
does StationMD have experience doing assistive technology evaluations in schools? That's all that she's written.
Yeah, I mean, I guess the short answer is we can see children, we can see any age, and we are at some schools that we, you know, they have one of our stations up there. We call it the station. They have a tablet, and we do evaluations, if that's what they're referring to. That, yeah, absolutely. There's no impediments to that.
Is that it in the chat box in the Q&A? Cindy?
Cindy, I think
That's all that we have. If people want to type in their questions, feel free to do so either in the Q&A or the chat box.
I want to say too, a reminder that all the PowerPoint presentations from today will be available next week on the website. So if you missed anything specific.
Also, Jamie, we were talking earlier about, you know, we really are striving to have a face-to-face, real in-person conference next spring. And I believe we've already set a date for that, haven't we?
Yes, April 29th and 30th, 2021.
2021.
Fingers crossed.
Fingers crossed and prayers answered, we hope. Yeah. Well, Dr. Trivedi, that was a great presentation. We thank you for coming and sharing kind of a tidbit of what you all are doing. And, you know, StationMD, before it seemed kind of novel and wow, but I think with COVID, it really sees the reality of how important and innovative it was on the frontier side when y'all started this. And now everybody really sees how it can become reality, is how we go see our doctors.
Yeah, no, yeah, that's true. I mean, I think that I honestly believe that it will be the standard of care at some point. And I think the one thing I would say is that, you know, you may have it with your own insurance, and I think the value of telehealth has been underscored and emphasized by COVID, but the value for using this kind of solution is really important for our population, because it is difficult to get transportation arranged. They can't necessarily go by themselves, and there's other issues of specialized care. Doctors aren't available. So yeah, we are hoping that our good work continues, and it's not me, it's all of our physicians that are doing it, and hopefully we'll be down in Mississippi. So I really appreciate it, and thank you for having us on.
Thank